Okay, let's dive into this. Welcome to this explainer, where we're going to take a super dense piece of information and completely unpack it piece by piece to truly understand the landscape it belongs to. Today, well, we've got a fascinating piece of pharmaceutical news. Sometimes the absolute biggest shifts in modern medicine, they're announced in what looks like just a standard run-of-the-mill digital update. But as focused learners, we know that if we look a little closer, there is a literal wealth of strategy, science, and global impact packed into just a few words. So today, we're unpacking a recent medical rollout. We're going to deconstruct this launch to understand exactly what's happening at the intersection of major pharma players, specialized medicine, and global markets.
Right, so here is the concise headline pulled directly from our source material. BMS launches Oncodermatherapy Relopduo in India. Now, on the surface, it's just 9 words, just a simple statement of fact, right? But within this one single sentence, we actually have a massive corporate entity, a cutting-edge medical intersection, a brand new therapeutic solution, and a highly strategic geographical deployment, all converging at the exact same time. It's honestly a perfect microcosm of how modern healthcare actually advances. To truly grasp what this means and the ripple effects it's going to create, we can't just skim it. We've got to really dissect it.
To start off our dissection, let's actually look at the digital footprint of this announcement, the URL structure itself, straight from the Economic Times. Notice the categorization here. It's totally bypassing the R&D and clinical trial buzz and landing straight into approvals and launches. This is absolutely crucial. It tells us that those grueling regulatory hurdles, they're in the rearview mirror, and we're looking at an end-stage commercial event. A product has officially cleared the regulatory gauntlet and is right now entering the real world.
And this brilliantly illustrates the scientific weight of this announcement. We are dealing with two massive, traditionally distinct fields here: oncology and dermatology. Historically, these disciplines operated in totally separate silos within a hospital infrastructure. The cancer specialists and the skin specialists, they basically ran on completely parallel tracks. But the future of modern medicine, it lies right in their intersection. Bridging the gap between a cancer focus and a skin focus is a huge leap in patient care, and it basically requires the breakdown of decades of clinical compartmentalization.
Which brings us to the term right smack in the middle of our headline, oncoderma. Now, why should you care about this specific intersection? Well, because it represents a critical shift toward managing the systemic burden of cancer therapies. It essentially acknowledges that treating the underlying disease often wreaks total havoc on the skin, and to get truly holistic care, we need dedicated crossover solutions. And oncodermatherapy means the medical community is moving way beyond just treating the tumor. They are directly addressing a deeply specific, highly complex patient need to ensure a really comprehensive quality of life, both during and after treatment.
Okay, now let's focus on the very first word of our headline, BMS, Bristol Myers Squibb, the maker. Look, when a giant like BMS attaches its name to a launch, it completely dictates the resources, the research weight, and the distribution power behind the therapy. BMS putting their massive R&D weight and distribution muscle behind an oncodermatherapy? That signals that this isn't just some niche offshoot anymore. It's fast becoming a major pillar of specialized care. They are signaling a really significant, long-term investment into this exact cross-section of medicine.
Moving into the core of the headline, we arrive at the absolute center of this whole announcement, the solution itself, Relopduo. Relopduo is the tangible result of navigating that incredibly complex oncoderma intersection we just talked about. It transitions this whole idea from just a clinical ideal into a physical therapy that healthcare professionals can actually prescribe today. It represents a highly targeted solution that is ready to be deployed right into the hands of the medical community to tackle those nuanced clinical challenges head-on. But how exactly does a therapy navigate into the hands of those doctors? Well, the phrase drug approvals and launches from our source path perfectly outlines the momentum of this rollout. Moving from the rigorous safety reviews of an approval straight into the logistical complexities of a market launch, it means Relopduo has survived the gauntlet. BMS is now actively shifting gears from proving the science to actual commercial deployment, which is a phase that requires an entirely different set of operational muscles and strategic planning.
So where is this massive deployment happening? The headline specifically targets India, and deploying a specialized oncodermatherapy into a dynamic market of this scale, it isn't just about patient volume, it's a massive strategic move to establish a footprint for advanced, cross-disciplinary therapies in rapidly growing global healthcare infrastructures. It really speaks to the global nature of pharmaceutical strategy, and the deliberate effort to integrate highly nuanced medical solutions into diverse, constantly evolving health systems. Finally, we've got to consider who is actually amplifying this information. The domain of our source sits specifically within the pharma section of the Economic Times. The fact that this is being amplified right there signals exactly who is watching this space.
regional healthcare professionals, financial analysts, and market competitors. It's a crystal-clear indicator to the local economy that a major new medical asset has landed. It's a total convergence of business strategy, market validation, and medical capability, all rolled into one highly targeted publication.
So we've taken a single, concise headline and completely unpacked the science, the corporate strategy, the regulatory momentum, and the global market implications hidden right inside it. We've seen how BMS is bridging cancer and skincare with Relopduo on a massive strategic scale, but as we wrap up this explainer, I really want to leave you with a thought to carry forward. With Relopduo now successfully launched in a dynamic market like India, what is the next frontier for oncoderma therapies? Are we going to see even more specialized intersections of medicine breaking down clinical silos in the near future? The landscape of healthcare is constantly evolving, and by learning how to decode the strategy behind these announcements, you're perfectly positioned to watch it all unfold. Keep questioning, keep learning, and I'll see you in the next explainer.